Hi there, welcome to my presentation on the adherence to antiretroviral therapy among persons with disabilities living with HIV in Nigeria. I'd like to pay my respect to the traditional owners of the land on which KUT now stands. I recognize that these lands have always been places of research, teaching, and learning. My positioning for this research is that I've been in development work with experience in the field of HIV and disability for the past 6 years. I have also lost my parents to HIV. Some definitions before we proceed. HIV is a virus which affects the human immune system. If not managed, will manifest as acquired immune deficiency syndrome, AIDS. Because there is no cure for HIV at the moment, HIV is being managed by drugs or medicines that are known as antiretroviral therapy. Adherence to ART, antiretroviral therapy, means taking the right drugs at the right time with the right dosage and the right nutritional requirements. Non-adherence, on the other hand, is not taking the drugs appropriately. Some context for Nigeria where the research will be holding. Nigeria has a population of over 200 million people. Over 20 million people in Nigeria are persons with disabilities. 1.9 million people are living with HIV in Nigeria. The United Nations Convention on the Rights of Persons with Disability, which is the international treaty that protects the rights of persons with disabilities globally, was ratified by Nigeria in 2010. However, Nigeria's disability law was only signed in January 2019. There are some social cultural constructions surrounding HIV and disability. Some surrounding HIV within the Nigerian context is that surrounding disability within the Nigerian context is that disability is caused by witchcraft or evil spirit, or some people believe that disability is caused by a spiritual deity or God as a punishment for some form of disobedience. HIV holds some similar construction as well as disability. Some of the social cultural constructions surrounding HIV is that HIV is understood by some to be caused by sexual intercourse by a woman who has had a miscarriage, or some people believe that it's an innovation of the West as a result for the aim of racial genocide. Some people believe that HIV is a punishment from God. Others believe that HIV is caused by sexual intercourse with animals. Some people believe that HIV does not exist at all. Some effects of this social cultural construction of disability is that it has led to the killing of some persons with disabilities for ritual purposes because they are believed to be a means to wealth. Some persons with disabilities are used as alms begging. Children are at the center of this. The picture there depicts a boy begging with his visually impaired father on the streets of Nigeria. Some other effects of this social cultural construction of disability is the raping of female persons, women who are living with disabilities, because they are believed to hold the key to long life or wealth. The concept of virgin cleansing, where people believe that sexual intercourse with virgins will cure them of HIV. Also, this places persons with disability at disadvantage. There's also marginalization of persons with disability in terms of access to health services and structures. The picture on the left there depicts a woman who is being helped to have access to a public building in Nigeria. The social exclusion at the intersection of HIV and disability has been registered in the forms of unavailability of technical aids or interpreters in hospitals or health facilities, lack of HIV information in brailles, and access to health facilities with examples such as ramps. Persons with disabilities are generally regarded as being asexual who do not need sex information, and so they are excluded from receiving adequate sex information to protect themselves. There's also the exclusion of persons with disabilities in education and employment, which ultimately leads to poverty. The Joint United Nations Program on HIV/AIDS, UNAIDS, sets ambitious strategies to combat HIV in 2020 and 2030. These strategies were known as 90-90-90 and 95-95-95. The explanation of this is the first 90 or 95 means 95% of all persons living with HIV will know their HIV status through HIV testing. The second 95% or 90% of those who have been diagnosed or know their HIV status will be enrolled in care, that is, will start receiving ART. For those who are already enrolled in care and taking antiretroviral therapy, which is the last 90, will achieve viral suppression. Achieving viral suppression can only be attained if persons adhere to HIV treatment. This is, of course, where my research comes into play, because these goals are, although there has been progress, the goals are currently not met because of the exclusion of persons with disabilities in HIV programming. And so if persons with disabilities are excluded as a result of the stigma and some of the constructions which we've seen earlier, it then becomes very difficult for them to adhere to treatment. My research problem, as itemized in the previous slide, is registered in forms of unavailability of technical aid interpreters. Persons with disabilities living with HIV do not have access to health facilities, the issues of stigma as well, and persons with disabilities living with HIV suffer multiple forms of stigma because of their multiple identities of having HIV and living with HIV and disability. I hope to explore these factors or structures that support or mitigate the adherence to antiretroviral therapy for persons with disabilities living with HIV in Nigeria. 4 objectives have been itemized for my study. I hope to explore the beliefs and the perceptions, also to look at the practices of health practitioners in terms of access for persons with disabilities living with HIV, and also to look at the intersecting factors that affect the adherence to antiretroviral therapy of persons with disabilities in Nigeria. It is hoped that some recommendations will be formulated from this study to guide HIV and disability programming for government and development partners. This is the first study that is being carried out in Nigeria, and I'm hoping that the findings from this study will serve as advocacy tool to address some of the structural issues that are facing persons with disabilities living with HIV in Nigeria. I will be using the intersectionality as my theoretical framework, which hopes to look at the multiple interactions of the multiple forms of discrimination and oppression that persons with disability living with HIV face. This is going to be a qualitative study, and I will be taking data from primary participants who are persons with disabilities living with HIV, as well as secondary participants who are health practitioners working in the field of HIV and disability. My recruitment sites are in 6 states of Abuja, Plateau State, Benue, Enugu, Abia, and Akwa Ibom states. My inclusion criteria, I will be focusing on just persons with physical and sensory disabilities who are living with HIV, whether on those who are enrolled in care or not. I'll also be focusing on just persons who are above 18 years. Persons with other forms of disabilities, intellectual disabilities, will be excluded. People who are also persons with disabilities who are HIV negative will not be included in the study. My methods for collection of data for primary participants are in-depth interview, structured observation, and note-taking. Secondary participants will be health practitioners or professionals or development workers who are working in the field of HIV and disabilities. Those without experience in the field of HIV and disability will be excluded. My data collection, my data analysis will be done thematically. The ethical consideration or the approval for this study has been submitted to the QUT Human Research Ethics Committee and awaiting approval. I have received approval for this research from the National Health Research Ethics Committee of Nigeria. My supervisory team is Dr. Julie King and Dr. Joe Durham, and I've continued to enjoy their mentorship and guidance on my research journey. Thank you very much for listening, and I look forward to your questions.